Most heart attacks people picture are dramatic. Sudden chest pain, a hand clutching the chest, someone collapsing in front of others. But a lot of the most dangerous cardiac events happen quietly, in the middle of the night, while a person is simply asleep. No drama, no warning, just a slow chain of events that started hours earlier with something completely unremarkable. Here's what tends to surprise people once they hear it laid out. The habits involved aren't rare or extreme. They're ordinary. A late dinner, a skipped glass of water, a bedroom that's a little too warm. Small choices most of us make without a second thought. Tonight, we're going through 5 of these everyday habits, the ones research keeps connecting to nighttime heart strain in adults over 60. And, more importantly, 5 simple adjustments that may help protect your heart while you sleep. None of them require a major lifestyle overhaul. Stay with us to the end, because the last one is the easiest of them all, and it costs nothing. Hi, welcome back. I'm glad you're here. If you're new to the channel, this is where we take what's actually going on inside the aging body and explain it the way a knowledgeable friend would. Plainly, honestly, without the scare tactics. A quick note before we start, this is educational information, not personal medical advice. Nothing here replaces a conversation with your own doctor. And I'd really encourage you to stay through to the end today, because these 5 habits tend to connect to each other in ways that aren't obvious until you see the whole picture. Let's start with something most people don't think about at all: the temperature of the room you sleep in. Walter, 69, always liked his bedroom warm. Cozy, he called it. Thick blankets, heat turned up a little higher than his wife preferred. It never occurred to him that this had anything to do with his heart. Here's what's happening physiologically. Your cardiovascular system tends to function best within a fairly narrow temperature range while you sleep. When a bedroom runs warm, researchers often point to somewhere above the low 70s Fahrenheit. Your body has to keep working to release that extra heat all night long. Blood vessels widen, heart rate can stay slightly elevated, and you may sweat more than you realize, which can leave you a bit dehydrated by morning. Go too far in the other direction, and a bedroom that's genuinely cold creates a different kind of strain. When your body gets cold, blood vessels tend to narrow to help preserve core temperature. That narrowing can raise blood pressure, meaning your heart has to push against more resistance to do its job. For someone who already has some degree of arterial stiffness, which becomes more common with age, that extra resistance is not nothing. Most sleep researchers suggest a bedroom somewhere in the mid-60s to low 70s. Fahrenheit tends to strike the right balance, cool enough to support deep sleep, not so cold that blood vessels tighten unnecessarily. It's a small dial to turn, but it's one of the easiest changes on this entire list, and it may quietly support both your sleep and your heart at the same time. Now, here's a habit that feels responsible on the surface, but may actually work against you overnight. A lot of people over 60 do this intentionally, thinking it's the smart move. They stop drinking water in the evening to avoid waking up for the bathroom. Carol used to do exactly this. She'd cut herself off from fluids around 4 in the afternoon, hoping for an uninterrupted night. It made sense to her. Fewer trips to the bathroom, less risk of stumbling in the dark, better sleep overall. But here's the piece that's easy to miss. When you're even mildly dehydrated, your blood becomes thicker and doesn't move through your vessels quite as easily. Combine that with what naturally happens during sleep. Your heart rate slows down, circulation slows with it, and your body stays still for 7 or 8 hours. Slower moving, thicker blood, traveling through arteries that may already be somewhat narrowed, is a combination worth paying attention to, particularly for people with existing cardiovascular risk factors. The good news is, this doesn't require choosing between hydration and a good night's sleep. Most experts suggest 1 modest glass of water, around 8 ounces, a little before bed is usually enough to help without triggering multiple trips to the bathroom. Keeping a second glass on the nightstand for if you wake up thirsty is a simple habit that costs nothing and takes 10 seconds. Carol's version of this now: 1 glass with her evening medications, 1 glass by the bed. She still sleeps through most nights. The difference, she says, is she's not lying there dehydrated and telling herself it's fine. That brings us to something almost nobody thinks to ask their doctor about directly. Here's a question worth sitting with. If you take blood pressure medication, do you know whether the time of day you take it actually matters? For a lot of people, it does, more than most realize. Blood pressure naturally follows a rhythm through the day. It typically rises in the morning, holds through the afternoon, and dips at night, giving your cardiovascular system a kind of nightly rest period. But in a meaningful number of older adults, especially those managing hypertension, that nighttime dip doesn't happen the way it's supposed to. Blood pressure can stay elevated overnight or even climb in the early morning hours, a pattern sometimes called nocturnal hypertension. This matters because your arteries aren't necessarily built to handle a pressure surge at 3 in the morning the same way they'd handle one in the middle of a busy afternoon. Research has associated poorly controlled nighttime blood pressure with a higher risk of cardiovascular events during sleep. Frank found this out somewhat by accident. He'd always taken his blood pressure pill first thing in the morning, right alongside his coffee. Simple, easy to remember. At a routine visit, his doctor asked whether he'd ever considered moving it to the evening instead. Frank hadn't. Neither had most of his friends, as it turned out, when he brought it up at his weekly card game. To be clear, this isn't something to change on your own. Some medications are timing sensitive, others aren't, and it depends heavily on the individual. But it's a 2-minute question worth asking at your next appointment. Does it make sense for me to take this in the evening instead of the morning? For some people, the answer changes very little. For others, it may meaningfully improve how well their body is protected overnight. Now, let's talk about a sound a lot of families have learned to laugh off. One that may deserve a second look. If you're finding this useful, go ahead and hit like and subscribe. It genuinely helps us keep making content like this for people who want real, grounded health information instead of headlines built to scare you.